The Honourable Trevor Khan.
My question is to the Minister for Health. When will you confirm the timelines for the delivery of overdue hospital projects across New South Wales? When can the residents of the regions served by the hospitals of Dubbo, Port Macquarie, Grafton and Wagga Wagga expect long-awaited redevelopment and upgrade plans to be turned into bricks and mortar? Minister, when asked in this place about the future of the Tamworth Hospital redevelopment on the 29th of October, you said, and I quote, "The Treasurer will go to the lower house on 11 November to deliver the mini-budget, and at that time all members will know the answers to these matters." Minister, given there was no mention of the redevelopment this morning, will you now confirm that the Tamworth Hospital redevelopment will be delivered on time and as promised?
Well, you didn't listen to the very excellent speech that the Treasurer gave in the other place. In the mini-budget, the government has committed $2.7 billion over the next 4 years on hospitals and other health infrastructure. This includes, and the Treasurer specified them in his speech, the $950 million redevelopment of the Royal North Shore Hospital, the $390 million expansion of the Liverpool Hospital, the $212 million Newcastle Mater redevelopment, the $145 million Auburn Health Services redevelopment, the $250 million redevelopment of Orange Base Hospital, and the $27 million Lismore Cancer Centre. And of course, as I said, we are, what I said is we are facing squarely the challenges ahead of us in strengthening the New South Wales budget. Health, of course, remains our top priority. It's not about slashing services. On the contrary, a mini-budget has been constructed so the core activities of government, the services that families need, continue to be delivered. The New South Wales Government is investing in delivering better services and improving health infrastructure. I'll get to it. I've got 4 minutes. Since 1995, this government has delivered more than 50 major hospital projects. Since 1995, well, 2 months. It's what we've done in 10 years. It's important. Yeah. Since 1995, the government has delivered. Okay, listen to it. Listen to it. This government has delivered. Yeah, we'll take the full quote. This government has delivered more than 50 major hospital projects and invested $5 billion in capital works for the New South Wales public health system. The government has upgraded or rebuilt almost every major hospital and emergency department in New South Wales. And in answer to the member's question, in regard to those matters, we are also negotiating with the Commonwealth Government on projects to be delivered through the Health Infrastructure Fund. And it's great to have a Commonwealth Government at last. It's great to have a Commonwealth Government at last which is interested in funding hospital infrastructure. Subject to those discussions, some planned capital works may be brought forward and others deferred to ensure the future capital program is realistic and affordable. Well, I just answered the question. We are negotiating with the Commonwealth Government on projects to be delivered through the Health Infrastructure Fund. Subject to those discussions, some planned capital works may be brought forward and others deferred to ensure the future capital program is realistic and affordable. I will be providing further information to the House on these capital projects as soon as practicable and as those negotiations come to fruition. The government is committed to delivering state-of-the-art medical facilities across the state in a responsible and effective way. The mini-budget and our negotiations with the Commonwealth around vital projects is an important part of delivering on that commitment.